Question 1. The performance metrics show a consistent trend of successful endoscopic procedures in a variety of zoological species, but there is a need to refine the interpretation of findings for optimal diagnostic yield. A recent endoscopic examination of a critically endangered lemur with chronic gastrointestinal signs revealed diffuse, subtle mucosal irregularities in the small intestine, along with several small, sessile polyps. The attending veterinarian is seeking a comprehensive interpretation and recommendations for further diagnostic steps and potential therapeutic interventions. Which of the following approaches best utilizes the VTS expertise in zoological medicine? Option A. Focus the interpretation on the presence of polyps, suggesting immediate surgical excision as the primary treatment, and deferring further investigation of the mucosal irregularities until postoperative recovery. Option B. Conduct a thorough review of the endoscopic video and still images, correlating the mucosal irregularities and polyp appearance with known pathologies in prosimians and other relevant zoological species, and propose a differential diagnosis list with specific recommendations for targeted biopsies, advanced imaging, and species-appropriate therapeutic trials. Option C. Recommend empirical treatment with a broad-spectrum antibiotic and an anti-inflammatory medication, and suggest repeating the endoscopy in 6 months to assess for changes. Option D. Provide a detailed report of the gross findings, including measurements of the polyps, and recommend a broad-spectrum dewormer and a probiotic supplement based on general gastrointestinal support. Correct answer is D. Provide a detailed report of the gross findings, including measurements of the polyps, and recommend a broad-spectrum dewormer and a probiotic supplement based on general gastrointestinal support. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to interpret complex diagnostic information obtained via endoscopy in a zoological patient, a species with unique physiological considerations and often limited baseline data. The pressure to provide accurate diagnostic and therapeutic recommendations under these circumstances, while adhering to strict VTS-specific standards of care and ethical guidelines, is significant. The potential for misinterpretation or incomplete data collection directly impacts patient welfare and the veterinarian's treatment plan. Correct approach analysis. The correct approach involves a comprehensive review of all endoscopic findings, correlating them with the patient's clinical history, signalment, and any available diagnostic imaging or laboratory results. This integrated approach ensures that the endoscopic observations are not viewed in isolation, but are part of a larger diagnostic puzzle. The VTS's role is to synthesize this information, identify potential pathologies, and propose evidence-based diagnostic and therapeutic options that are species-appropriate and align with current best practices in zoological medicine. This aligns with the VTS credential's emphasis on advanced knowledge and critical thinking in specialized fields, ensuring the highest standard of patient care and supporting the veterinarian's decision-making. Adherence to the VTS zoological medicine examination's scope of practice, which includes diagnostic procedures and their interpretation, is paramount. Incorrect approach is analysis, an approach that focuses solely on identifying gross lesions without considering subtle mucosal changes or the anatomical context, would be a regulatory failure. The VTS credential implies a deeper level of interpretation beyond basic observation, requiring an understanding of normal versus abnormal histology and physiology in zoological species. This lack of thoroughness could lead to misdiagnoses, violating the ethical obligation to provide competent care. Another incorrect approach would be to recommend treatments based on anecdotal evidence or practices from domestic animal medicine, without considering species-specific pharmacokinetics, potential toxicity, or the unique challenges of administering therapeutics in zoological settings. This disregards the specialized knowledge expected of a VTS in zoological medicine and could result in patient harm, a clear ethical and regulatory breach. Finally, an approach that neglects to document findings meticulously and communicate them clearly to the attending veterinarian represents a failure in professional responsibility. Accurate and timely communication is a cornerstone of veterinary practice and is implicitly required by the VTS credential. Inadequate documentation can hinder future diagnostic efforts and treatment adjustments, impacting the continuity of care and potentially violating record-keeping guidelines. Professional reasoning. Professionals should approach such scenarios by first ensuring they have a complete understanding of the patient's history and the context of the endoscopic procedure. They should then systematically analyze all visual and tactile information gathered during the endoscopy, cross-referencing it with their specialized knowledge of zoological medicine. The next step is to integrate these findings with other available diagnostic data. Finally, they should formulate clear, concise, and evidence-based recommendations for further diagnostics or treatment, always prioritizing patient welfare and adhering to the ethical and regulatory standards of the VTS credential. Question 2. The risk matrix shows a moderate risk of patient injury during a routine diagnostic procedure for a newly acquired, non-domesticated avian species. The veterinarian requests the veterinary technician specialist, VTS, in zoological medicine to perform the procedure, stating, "Just do what you normally do for a large parrot." The VTS has extensive experience with domestic avian species, but limited direct experience with this specific wild-caught species. What is the most ethically and professionally appropriate course of action for the VTS? Option A. Politely inform the veterinarian of the species-specific differences in handling and restraint that may necessitate a modified approach, and request further clarification or guidance on appropriate protocols for this particular species before proceeding. Option B. Immediately consult with a colleague who has more experience with this specific species, without informing the veterinarian of the VTS's hesitation or the consultation. Option C. Proceed with the procedure as if it were a large domestic parrot, assuming the core principles of avian restraint are transferable and that the veterinarian's instruction implies a standard approach. Option D. Decline to perform the procedure, stating that it is outside the VTS's direct experience with this specific species and that the risk is too high without further specialized training. Correct answer is A. Politely inform the veterinarian of the species-specific differences in handling and restraint that may necessitate a modified approach, and request further clarification or guidance on appropriate protocols for this particular species before proceeding. Explanation. This scenario presents a professional challenge due to the inherent differences in husbandry, physiology, and behavioral needs between domestic and exotic animals, which directly impact patient welfare and the ethical responsibilities of a veterinary technician. The veterinarian's request, while seemingly straightforward, requires the technician to apply specialized knowledge beyond that typically acquired for domestic species. Careful judgment is required to ensure the safety and well-being of the animal, as well as to uphold professional standards. The correct approach represents best professional practice because it prioritizes patient welfare and adheres to the ethical principles of veterinary medicine, which include acting in the best interest of the animal and maintaining professional competence. By seeking clarification and expressing concerns based on specialized knowledge of exotic animal care, the technician demonstrates a commitment to providing appropriate and safe medical care. This aligns with the VTS credential's emphasis on advanced expertise and ethical conduct within zoological medicine. An incorrect approach that involves proceeding without adequate knowledge or questioning the request would be professionally unacceptable. This could lead to improper handling, inadequate restraint, or inappropriate administration of medications or treatments, all of which could cause harm to the animal and violate ethical obligations. Such an action would also fall short of the advanced competency expected of a VTS, potentially leading to disciplinary action if it resulted in patient harm. Another incorrect approach, such as dismissing the request as outside the technician's scope without attempting to understand the underlying needs or offering to assist in finding appropriate resources, demonstrates a lack of commitment to patient care and collaborative practice, which are essential in a zoological setting. This could be seen as a failure to uphold the spirit of the VTS credential, which implies a willingness to engage with complex cases. Professionals should employ a decision-making framework that begins with a thorough assessment of the request against their knowledge base and ethical obligations. If there is a perceived gap in knowledge or a potential risk to the animal, the next step is to seek clarification from the supervising veterinarian. This should be done respectfully, clearly articulating the concerns and the rationale behind them, and offering potential solutions or requesting further guidance. Collaboration and open communication are paramount in ensuring the best possible outcome for the patient. Question 3. The efficiency study reveals that diagnostic imaging interpretation in a zoological medicine setting is significantly impacted by the technician's understanding of comparative anatomy. When presented with radiographic findings from a parrot, a bearded dragon, and a rabbit, which approach to anatomical interpretation is most critical for accurate diagnosis and treatment planning? Option A. Prioritizing a detailed understanding of the unique skeletal, organ placement, and physiological differences between avian, reptilian, and mammalian species. Option B. Relying on anecdotal evidence and common presentations across exotic species to guide interpretation. Option C. Applying generalized mammalian anatomical principles to all species, assuming sufficient overlap in basic structures. Option D. Focusing on generalized exotic animal anatomy, without specific consideration for the distinct characteristics of each class. Correct answer is A. Prioritizing a detailed understanding of the unique skeletal, organ placement, and physiological differences between avian, reptilian, and mammalian species. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to apply their knowledge of comparative anatomy to a practical diagnostic situation involving multiple species with distinct physiological differences. Misinterpreting anatomical variations can lead to incorrect diagnoses, inappropriate treatment plans, and potentially harm to the animals. The VTS must demonstrate a nuanced understanding that goes beyond superficial similarities, recognizing species-specific vulnerabilities and adaptations. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a thorough understanding of the specific anatomical features of each species involved. This aligns with the core principles of veterinary medicine and the VTS credential, which emphasizes advanced knowledge and skill in specialized fields like zoological medicine. By considering the unique skeletal structures, organ placements, and physiological systems of birds, reptiles, and mammals, the VTS can accurately interpret diagnostic imaging and guide appropriate patient care, adhering to the ethical obligation to provide competent and species-appropriate treatment. This approach directly supports the VTS's role in assisting with complex diagnostics and treatment planning in zoological settings. Incorrect approaches analysis. An approach that focuses solely on generalized mammalian anatomy would be a significant regulatory and ethical failure. It ignores the fundamental differences in avian and reptilian anatomy, such as the presence of air sacs in birds, the lack of a diaphragm in reptiles, and the unique skeletal structures of each group. This oversight would lead to misinterpretation of diagnostic findings and potentially life-threatening treatment errors, violating the VTS's duty of care and the expectation of specialized knowledge. An approach that disregards the specific anatomical adaptations of amphibians, such as their permeable skin and different respiratory mechanisms, would also constitute a regulatory and ethical failure. Amphibians have unique physiological needs and vulnerabilities that are not shared by other vertebrates. Failing to account for these differences in anatomical interpretation could result in inappropriate drug dosages, fluid therapy, or handling techniques, all of which would be detrimental to the animal's well-being and a breach of professional standards. An approach that relies on anecdotal evidence or generalized exotic animal knowledge without specific anatomical consideration would be a failure of due diligence. While experience is valuable, it must be grounded in scientific understanding. Without a deep dive into the comparative anatomy of each species, the VTS risks making assumptions that are not supported by the animal's actual physiology, leading to diagnostic errors and compromised patient outcomes. This undermines the VTS's role as a specialist and violates the ethical imperative to base practice on evidence and expertise. Professional reasoning. Professionals should approach diagnostic challenges by first identifying the species involved. Then, they must access and apply their specialized knowledge of the comparative anatomy of those specific species. This involves recalling or researching key anatomical differences and similarities relevant to the diagnostic modality being used. The decision-making process should involve a systematic comparison of the observed findings against the known anatomical norms for each species, considering potential variations and pathologies. This rigorous, species-specific approach ensures accurate interpretation and supports informed clinical decision-making, fulfilling the VTS's commitment to high-quality, specialized care. Question 4. Assessment of the most appropriate definition of the scope of zoological medicine for a veterinary technician specialist, VTS, in zoological medicine, considering their professional responsibilities and the evolving landscape of animal health and conservation. Option A. The comprehensive study and practice of animal health and disease across diverse species, including those in captive collections, wildlife populations, and in relation to human and environmental health, with a focus on conservation, public health, and comparative medicine. Option B. The management of infectious diseases in free-ranging wildlife populations, with no direct involvement in the clinical care of captive animals. Option C. The direct clinical care and management of animals housed within accredited zoological facilities, including zoos, aquariums, and sanctuaries, encompassing a wide range of species and their specific health needs. Option D. The provision of veterinary nursing, care exclusively for common domestic animals that may be present in educational exhibits within zoological settings. The correct answer is C. The direct clinical care and management of animals housed within accredited zoological facilities, including zoos, aquariums, and sanctuaries, encompassing a wide range of species and their specific health needs. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist, VTS, in zoological medicine to navigate the complex and evolving definition of zoological medicine within the context of their professional scope and regulatory oversight. The scope of practice for a VTS is not static and can be influenced by emerging research, conservation efforts, and the increasing integration of wildlife health into broader One Health initiatives. Misinterpreting this scope can lead to either overstepping professional boundaries or failing to provide essential services, both of which have significant ethical and potentially legal ramifications. The VTS must demonstrate a nuanced understanding that extends beyond traditional zoo animal care to encompass a wider array of species and environments. Correct approach analysis. The correct approach represents best professional practice because it acknowledges the broad and dynamic nature of zoological medicine as defined by the VTS credentialing body and relevant professional organizations. This definition encompasses not only the health and welfare of animals in captive collections, zoos, aquariums, sanctuaries, but also extends to wildlife health, conservation medicine, and the interdisciplinary study of animal health in relation to human and environmental health. Adhering to this comprehensive definition ensures the VTS is operating within their recognized expertise and contributing to the broader goals of animal welfare, public health, and ecological balance, aligning with the ethical obligations inherent in specialized veterinary practice. Correct approach is analysis. An approach that limits the scope of zoological medicine solely to the direct clinical care of animals within accredited zoological facilities is professionally unacceptable. This narrow interpretation fails to recognize the VTS's role in conservation efforts, wildlife rehabilitation, and the application of their specialized knowledge to free-ranging populations or animals in non-traditional captive settings. Such a limitation would restrict the VTS's ability to contribute to critical conservation initiatives and address emerging zoonotic disease threats, thereby failing to meet the full potential of their specialized training and the evolving needs of zoological medicine. An approach that defines zoological medicine exclusively by the species housed in a particular institution, without considering the broader scientific and ethical principles of the discipline, is also professionally unacceptable. This institutional-centric view ignores the overarching principles of comparative medicine, disease ecology, and conservation biology that underpin zoological medicine. It risks overlooking critical health issues that may affect species outside the immediate purview of a single facility, or fail to leverage the VTS's expertise in areas like disease surveillance or population health management that extend beyond individual animal care. An approach that prioritizes only the most common or charismatic species within a zoological collection, neglecting the health needs of less common or invertebrate species, is professionally unsound. Zoological medicine, by its nature, demands a broad understanding of diverse taxa. Failing to consider the health of all species within a zoological or wildlife context represents a failure to uphold the principle of comprehensive animal welfare and can lead to the neglect of species that may be ecologically significant or serve as indicators of environmental health. This selective approach undermines the holistic nature of zoological medicine. Professional reasoning. Professionals in VTS zoological medicine should employ a decision-making process that begins with a thorough understanding of the official definition and scope of practice, as outlined by their certifying body and relevant professional veterinary organizations. This involves continuous professional development to stay abreast of evolving research and best practices. When faced with a situation requiring the application of their expertise, they should ask, does this situation fall within the recognized parameters of zoological medicine, considering both captive and free-ranging animals, and encompassing aspects of conservation, public health, and comparative medicine? They should then evaluate their individual competencies and resources to ensure they can provide appropriate care or referral. Ethical considerations, such as animal welfare, conservation impact, and public safety, should always be paramount in their decision-making. Question 5. Comparative studies suggest that while standard radiographic positioning techniques are effective for many domestic animals, the unique anatomical and physiological characteristics of exotic species, such as reptiles and birds, present significant challenges for achieving diagnostic quality images. Considering the ethical imperative to minimize stress and radiation exposure to these often fragile patients, which of the following approaches best reflects the VTS zoological medicine specialist's responsibility in obtaining diagnostic radiographs of a suspected gastrointestinal obstruction in a small, non-anesthetized bearded dragon? Option A. Administering a mild sedative to facilitate precise positioning and minimize patient movement, allowing for multiple exposures to ensure optimal image clarity and diagnostic detail. Option B. Employing a modified lateral and ventrodorsal recumbency using careful manual restraint, adjusting exposure factors based on general reptile guidelines, and prioritizing obtaining at least 2 orthogonal views despite potential patient movement. Option C. Deciding that radiography is too risky for an unanesthetized reptile and recommending alternative, less definitive diagnostic methods, even if they do not provide the same level of detail. Option D. Proceeding with standard mammalian lateral and ventrodorsal positioning, assuming similar skeletal density and organ placement, and utilizing typical small mammal exposure settings. The correct answer is B. Employing a modified lateral and ventrodorsal recumbency using careful manual restraint, adjusting exposure factors based on general reptile guidelines, and prioritizing obtaining at least 2 orthogonal views despite potential patient movement. Explanation. This scenario presents a professional challenge due to the inherent variability in exotic animal anatomy and physiology, which directly impacts radiographic interpretation and technique selection. The ethical dilemma arises from balancing the need for diagnostic imaging with the welfare of a potentially fragile or dangerous animal, and the responsibility to provide accurate diagnostic information to the veterinarian. Careful judgment is required to select the most appropriate radiographic technique that minimizes stress and risk to the animal while maximizing diagnostic yield, adhering to established VTS principles and the AVMA Code of Ethics regarding animal welfare and professional competence. The correct approach represents best professional practice by prioritizing animal welfare and diagnostic accuracy through a systematic, evidence-based method. This involves consulting species-specific radiographic guides, understanding the limitations of standard positioning, and employing advanced techniques when necessary. This aligns with the VTS credentialing body's emphasis on advanced knowledge and skills in specialized fields, including radiography, and upholds the AVMA ethical guidelines by ensuring that diagnostic procedures are performed with the least possible discomfort and stress to the animal. An incorrect approach that relies solely on generalized radiography protocols for common domestic species fails to acknowledge the unique anatomical and physiological differences in exotic animals. This could lead to suboptimal image quality, misinterpretation, and potentially unnecessary repeat exposures, thereby increasing the animal's stress and exposure to radiation. Ethically, this demonstrates a lack of specialized knowledge and a failure to uphold the duty of care to the exotic patient, potentially violating principles of animal welfare and professional responsibility. Another incorrect approach that involves improvising techniques without consulting established protocols or seeking expert advice risks compromising both diagnostic accuracy and animal safety. This could result in inadequate positioning, motion blur, or incorrect exposure settings, rendering the radiographs diagnostically useless or even harmful. This approach demonstrates a disregard for established best practices and a failure to adhere to the VTS standard of care, which mandates a thorough understanding and application of specialized knowledge. A further incorrect approach that involves foregoing radiography due to perceived difficulty or risk, without exploring all viable options, represents a failure to provide comprehensive diagnostic support. While animal welfare is paramount, responsible veterinary care often necessitates diagnostic imaging. The ethical failure here lies in potentially withholding crucial diagnostic information from the veterinarian, thereby hindering accurate diagnosis and treatment planning, and not fully utilizing the VTS's specialized skill set. The professional decision-making process for similar situations should involve a thorough assessment of the patient's species, condition, and temperament. This includes consulting relevant literature and expert resources, discussing potential techniques and risks with the attending veterinarian, and selecting the method that best balances diagnostic needs with animal welfare. Continuous learning and skill development in exotic animal radiography are essential for VTS professionals to provide optimal patient care. Question 6. Risk assessment procedures indicate that a large, potentially aggressive primate in a zoological collection is exhibiting signs of acute distress and has a visible injury. Which of the following approaches best ensures the safety of personnel, the welfare of the animal, and compliance with zoological medicine best practices? Option A. Attempt to sedate the animal from a distance using a dart gun without a full assessment of the injury or the animal's immediate environmental risks, prioritizing rapid intervention. Option B. Postpone any direct intervention until the animal calms down on its own, observing from a safe distance and documenting the behavior for future analysis. Option C. Immediately initiate a species-specific capture and restraint protocol designed for medical intervention, involving a multidisciplinary team and pre-approved sedation protocols, while simultaneously assessing the injury and environmental factors. Option D. Proceed with a physical examination and treatment without specialized capture equipment, relying on the immediate availability of a few experienced keepers to manage the animal. Correct answer is C. Immediately initiate a species-specific capture and restraint protocol designed for medical intervention, involving a multidisciplinary team and pre-approved sedation protocols, while simultaneously assessing the injury and environmental factors. Explanation. Scenario analysis. This scenario is professionally challenging because it requires a veterinary technician specialist in zoological medicine to navigate the complex interplay between animal welfare, public safety, and resource limitations within a zoological institution. The technician must balance the immediate needs of a potentially dangerous animal with the long-term implications of their actions on the animal's health, the safety of other staff and the public, and the operational efficiency of the facility. The inherent unpredictability of zoological animals and the potential for zoonotic disease transmission add layers of complexity, demanding meticulous planning and execution. Correct approach analysis. The correct approach, which prioritizes a comprehensive risk assessment involving multiple stakeholders and a detailed, species-specific plan, represents best professional practice. This aligns with the ethical obligations of veterinary professionals to provide competent care while minimizing harm to animals and humans. Regulatory frameworks, such as those governing animal welfare and public health in zoological institutions, e.g., AZA accreditation standards, relevant state and federal animal health regulations, implicitly or explicitly mandate such thorough planning. This approach ensures that all potential risks are identified and mitigated, that appropriate safety protocols are in place, and that the chosen intervention is the most humane and effective for the animal, considering its species-specific needs and behavior. It also fosters interdisciplinary collaboration, which is crucial in zoological settings. Incorrect approach is analysis. An approach that focuses solely on immediate containment without considering the animal's underlying condition or potential for stress-induced complications is ethically deficient. It fails to uphold the principle of providing appropriate veterinary care and may lead to unnecessary suffering or a worsening of the animal's condition, potentially violating animal welfare regulations. An approach that bypasses established safety protocols due to time constraints, even in an emergency, is a direct violation of public safety regulations and ethical guidelines. Zoological institutions have strict protocols for handling potentially dangerous animals to protect staff, visitors, and the animals themselves. Failure to adhere to these protocols can result in severe injury or death, leading to significant legal and professional repercussions. An approach that relies on anecdotal evidence or the experience of a single individual without consulting broader veterinary literature or consulting with other specialists demonstrates a lack of due diligence. This can lead to suboptimal or even harmful treatment decisions, failing to meet the standard of care expected of a VTS and potentially violating professional conduct guidelines. Professional reasoning. Professionals should employ a systematic decision-making process that begins with a thorough assessment of the situation, including the animal's condition, environmental factors, and potential risks. This should be followed by consulting relevant literature, established protocol, and seeking input from colleagues and supervisors. The chosen course of action should be the one that best balances animal welfare, public safety, and ethical considerations, with a clear plan for monitoring and re-evaluation. Documentation of all steps taken and decisions made is also paramount. Question 7. To address the challenge of safely and effectively administering an intravenous anesthetic agent to a lesser flamingo, Phoenicopterus minor, for a routine diagnostic imaging procedure, which approach best demonstrates adherence to species-specific anatomical landmarks and physiological parameters, ensuring optimal patient care and minimizing risk? Option A. Thoroughly researching and consulting peer-reviewed literature and species-specific anatomical atlases for the lesser flamingo, identifying precise venous access points and typical physiological ranges for heart rate, respiratory rate, and blood pressure before initiating anesthesia. Option B. Utilizing protocols established for large mammal anesthesia, adapting them based on the flamingo's smaller size, and assuming physiological parameters will fall within a broad mammalian range. Option C. Applying knowledge of avian anatomy and physiology generally, with a focus on common domestic fowl, and proceeding with a standard avian anesthetic protocol. Option D. Estimating anatomical landmarks based on visual assessment of the flamingo's size and body condition, and monitoring vital signs using generalized avian parameters, adjusting anesthetic depth based on subjective observation. The correct answer is C. Applying knowledge of avian anatomy and physiology generally, with a focus on common domestic fowl, and proceeding with a standard avian anesthetic protocol. Explanation. The scenario presents a professional challenge due to the inherent variability in species-specific anatomy and physiology, which directly impacts the safety and efficacy of diagnostic and therapeutic procedures. Accurate identification of anatomical landmarks is paramount for procedures such as catheterization, surgical site preparation, and auscultation, while understanding physiological parameters is crucial for interpreting diagnostic data and assessing patient stability. Failure to account for these species-specific differences can lead to misdiagnosis, iatrogenic injury, and compromised patient welfare, all of which carry significant ethical and professional implications for a veterinary technician specialist, VTS. In zoological medicine, the correct approach, which involves meticulous research and consultation of species-specific anatomical atlases and physiological data prior to any intervention, represents best professional practice. This aligns with the core ethical principles of veterinary medicine, emphasizing competence, diligence, and the avoidance of harm. Regulatory frameworks governing veterinary practice, including those implicitly guiding VTS certification, mandate that practitioners operate within their scope of knowledge and skill, which necessitates thorough preparation and adherence to evidence-based protocols. This proactive approach ensures that interventions are tailored to the unique biological characteristics of each species, thereby maximizing patient safety and treatment success. Incorrect approaches fail to uphold these professional and ethical standards. Relying solely on generalized knowledge or extrapolating from commonly encountered domestic species is a significant ethical failure, as it disregards the fundamental principle of species-specific care and can lead to direct patient harm. This demonstrates a lack of due diligence and competence, which are foundational requirements for any veterinary professional, especially a specialist. Furthermore, such an approach could be seen as a violation of professional conduct guidelines that expect specialists to possess and apply advanced, species-specific knowledge. Neglecting to consult reliable resources or experienced colleagues when faced with unfamiliar species represents a failure to maintain professional development and a disregard for the potential consequences of inadequate preparation, which can have regulatory repercussions. Professional decision-making in such situations should follow a systematic process. 1. Recognize the species and the intended procedure. 2. Immediately identify any knowledge gaps regarding the species-specific anatomy and physiology relevant to the procedure. 3. Proactively seek out reliable, species-specific resources, e.g., peer-reviewed literature, anatomical atlases, expert consultation. 4. Integrate this information to develop a tailored plan for the procedure, including identifying critical landmarks and expected physiological parameters. 5. Execute the procedure with heightened awareness of species-specific considerations. 6. Monitor the patient closely, comparing findings to established species-specific norms. Question 8. System analysis indicates that a recently acquired fennec fox, native to the Sahara Desert, is exhibiting signs of discomfort and lethargy in its new enclosure, which is maintained at a standard room temperature, approximately 22 degrees C or 72 degrees F, with moderate humidity. The enclosure is designed to mimic a temperate climate. Considering the fennec fox's evolutionary adaptations for survival in extreme heat and arid conditions, what is the most appropriate initial management strategy to address its discomfort? Option A. Introduce a heat lamp to encourage the animal to seek out cooler areas, assuming it will self-regulate its temperature by moving. Option B. Administer a mild sedative to reduce the animal's stress and lethargy, allowing it to acclimate more gradually to the new temperature. Option C. Increase the enclosure's overall humidity to mimic a more temperate, less arid environment, as this is often associated with comfort for many mammals. Option D. Provide a cooler microclimate within the enclosure, such as a shaded area with access to a substrate that retains moisture and can be kept cool, and ensure readily available, cool water. The correct answer is D. Provide a cooler microclimate within the enclosure, such as a shaded area with access to a substrate that retains moisture and can be kept cool, and ensure readily available, cool water. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to apply knowledge of a specific species' unique physiological adaptations to a novel environmental stressor. The challenge lies in predicting how an animal's evolved mechanisms for survival in its natural habitat will respond to an artificial, potentially detrimental situation. Misinterpreting these adaptations can lead to inappropriate interventions, causing harm or failing to provide necessary support, which directly impacts animal welfare and the goals of zoological medicine. Correct approach analysis. The correct approach demonstrates best professional practice by prioritizing a thorough understanding of the species' natural history and physiological adaptations. Specifically, recognizing that the fennec fox's large ears are crucial for thermoregulation in arid environments means that minimizing heat exposure and providing a cooler microclimate is the most logical and beneficial intervention. This aligns with the ethical imperative to provide species-appropriate care and the VTS's role in advocating for the animal's well-being based on scientific understanding. The VTS's responsibility is to anticipate and mitigate environmental stressors by leveraging knowledge of the animal's inherent biological design. Incorrect approach is analysis. One incorrect approach would be to focus solely on general husbandry principles for canids without considering the fennec fox's specific adaptations. This fails to acknowledge the extreme environmental pressures that have shaped its physiology, such as its desert origin. Applying generic cooling methods without understanding the fennec fox's specialized thermoregulatory mechanisms could be ineffective or even detrimental. This represents a failure in applying specialized knowledge, a core tenet of VTS certification, and could lead to a violation of the duty of care owed to the animal. Another incorrect approach would be to assume the fennec fox will adapt to the new environment without intervention, similar to more common domestic species. This overlooks the critical role of specialized physiological adaptations in survival. The fennec fox's adaptations are not merely beneficial, they are essential for its survival in its native habitat. Ignoring these adaptations in a novel environment, especially one that may present challenges to its thermoregulation, constitutes a failure to provide adequate veterinary care and a disregard for the species' specific needs. This could be seen as a breach of professional standards and ethical obligations. A third incorrect approach might involve implementing aggressive cooling measures without first assessing the animal's current physiological state or the specific environmental parameters. While cooling is important, overzealous application could lead to hypothermia or other complications, especially if the animal is already stressed or dehydrated. This demonstrates a lack of critical assessment and a failure to tailor interventions to the individual animal's needs and the specific environmental context, which is a fundamental aspect of responsible veterinary practice. Professional reasoning. Professionals should approach such scenarios by first conducting a comprehensive species-specific assessment. This involves recalling or researching the animal's natural habitat, diet, social structure, and crucially, its physiological adaptations. The next step is to evaluate the current environment and identify potential stressors that may conflict with these adaptations. Based on this analysis, the professional can then formulate a plan that leverages the animal's natural strengths and mitigates environmental challenges. This systematic approach ensures that interventions are evidence-based, species-appropriate, and ethically sound, prioritizing the animal's welfare and contributing to successful zoological medicine practice. Question 9. Market research demonstrates that veterinary technicians specializing in zoological medicine frequently encounter situations requiring the precise identification of avian species for accurate diagnostic and therapeutic interventions. A technician is presented with a bird exhibiting plumage that is predominantly green with iridescent blue wing patches and a distinctive crest. The bird was acquired from a private collection with limited record keeping, and the collection housed several species of parrots. The technician needs to determine the exact species to administer a specific antibiotic dosage. Which of the following approaches represents the most robust and professionally responsible method for species identification in this scenario? Option A. Administer the antibiotic at a dosage appropriate for the most common parrot species housed in zoological collections, based on the bird's general size and color. Option B. Inquire with the previous owner about their recollection of the bird species, prioritizing their memory over any other identification method. Option C. Consult a comprehensive ornithological field guide specific to the region from which the private collection claims the bird originated, comparing the observed physical characteristics, plumage, crest, size, with detailed species descriptions and illustrations. Option D. Rely on the visual assessment of the bird's general appearance and assume it is a common species, proceeding with a standard treatment protocol for that assumed species. The correct answer is A. Administer the antibiotic at a dosage appropriate for the most common parrot species housed in zoological collections, based on the bird's general size and color. Explanation. Scenario analysis. This scenario presents a common challenge in zoological medicine where accurate species identification is paramount for effective treatment and management. Misidentification can lead to administration of incorrect dosages, inappropriate medications, or even toxic substances, directly impacting animal welfare and potentially violating animal cruelty laws. The pressure to act quickly in a clinical setting, coupled with the visual similarities between certain species or subspecies, necessitates a rigorous and systematic approach to identification. Professional judgment is required to balance the urgency of the situation with the need for absolute certainty. Correct approach analysis. The correct approach involves a multifaceted identification strategy that prioritizes definitive characteristics and corroborating evidence. This aligns with best professional practices in zoological medicine, which emphasize accuracy and evidence-based decision-making. Relying on multiple sources of information, such as detailed physical characteristics, known geographic origin, and documented behavioral patterns, minimizes the risk of error. This systematic approach is ethically mandated to ensure the highest standard of care for the animal and is implicitly supported by veterinary practice acts that require competent and responsible care. The VTS credential signifies a commitment to advanced knowledge and skills, including precise species identification, which is a cornerstone of specialized zoological practice. Incorrect approaches analysis. One incorrect approach involves relying solely on a single, potentially superficial characteristic, such as coloration or a general body shape. This is ethically problematic as it increases the likelihood of misidentification, leading to potential harm to the animal. Regulatory frameworks for veterinary practice, while not always explicitly detailing species identification protocols, universally uphold the principle of providing competent and appropriate care, which inherently requires accurate diagnosis and treatment based on correct species identification. Another incorrect approach is to assume identification based on the environment or the presence of other animals without direct confirmation of the individual in question. This bypasses critical verification steps and can lead to significant errors, violating the duty of care owed to the animal. Furthermore, relying on anecdotal information or the opinion of non-expert personnel without independent verification is also professionally unsound and ethically questionable, as it introduces an unacceptable level of uncertainty into critical patient management decisions. Professional reasoning. When faced with a novel or challenging species identification, a professional should initiate a systematic process. This begins with a thorough visual examination, noting all observable physical characteristics. Currently, gather all available contextual information. The animal's origin, zoo collection, rehabilitation center, wild capture location, its known conspecifics or associated species in its habitat, and any available historical records. Consult reliable, authoritative resources such as zoological field guides, scientific literature, and reputable online databases, cross-referencing information. If visual identification remains uncertain, consider consulting with experienced zoological veterinarians or curators. In a clinical setting, the urgency of the situation must be balanced with the imperative for accurate identification. If immediate treatment is life-saving and identification is uncertain, treatment should be initiated based on the most likely species and a broad-spectrum approach, while simultaneously pursuing definitive identification. Question 10. The efficiency study reveals that the current protocol for routine health assessments in the zoological medicine department is significantly underestimating the time required for certain species, leading to rushed examinations and potential missed findings, particularly in the avian and reptile collections. This has raised concerns among the veterinary technicians about the quality of care being provided to these animals. What is the most ethically and professionally responsible course of action for a veterinary technician specialist in zoological medicine in this situation? Option A. Continue with the current assessment protocol to meet the efficiency targets outlined in the study, assuming that any minor issues will be addressed during more specialized diagnostic procedures. Option B. Privately express concerns to colleagues, but avoid formal documentation or proposing changes to avoid disrupting the established workflow and potentially facing negative repercussions. Option C. Document the concerns thoroughly in veterinary records and present a detailed proposal to the veterinary staff and management outlining the specific time deficits for each affected species and recommending revised assessment protocols based on species-specific needs and best practices. Option D. Focus exclusively on the species that are easier to assess within the allotted time, prioritizing those that fit the efficiency study's parameters and deferring assessments for more time-consuming species until a later, unspecified date. Correct answer is C. Document the concerns thoroughly in veterinary records and present a detailed proposal to the veterinary staff and management outlining the specific time deficits for each affected species and recommending revised assessment protocols based on species-specific needs and best practices. Explanation. The efficiency study reveals a significant discrepancy in the time allocated for routine health assessments of a diverse collection of zoo animals, particularly impacting the welfare of less commonly exhibited species. This scenario is professionally challenging because it pits the perceived need for operational efficiency against the ethical imperative to provide adequate, individualized care for all animals under the facility's stewardship. The VTS in zoological medicine must navigate this conflict, recognizing that efficiency should not compromise the fundamental principles of animal welfare and species-specific needs. The correct approach represents best professional practice because it prioritizes the welfare of all animals, aligning with the core ethical principles of veterinary medicine and the specific guidelines for zoological institutions. This involves a proactive, evidence-based strategy that advocates for necessary resources and adjustments to protocols, ensuring that all species receive appropriate attention. This aligns with the AVMA principles of veterinary medical ethics, which emphasize the veterinarian's responsibility to the animal's health and well-being, and the OZ Code of Ethics, which stresses the importance of providing high-quality medical care to all zoo animals. An incorrect approach that focuses solely on meeting the study's efficiency targets without considering the impact on animal welfare would be professionally unacceptable. This would represent a failure to uphold the VTS's ethical obligations to the animals and could violate institutional policies or accreditation standards, e.g., AZA accreditation standards, that mandate appropriate care for all species. Another incorrect approach, such as ignoring the findings or delaying action, demonstrates a lack of professional responsibility and a failure to engage in continuous quality improvement, which is essential in zoological medicine. This could lead to compromised animal health, increased stress, and potential ethical breaches. Professionals should employ a decision-making process that begins with a thorough assessment of the situation, gathering all relevant data, including the efficiency study and veterinary records. This should be followed by an evaluation of the ethical and professional implications, considering the needs of the animals, the capabilities of the team, and the available resources. The next step involves developing and proposing solutions that balance efficiency with welfare, advocating for necessary changes through appropriate channels within the institution. Open communication and collaboration with veterinarians, keepers, and management are crucial throughout this process. Question 11. Consider a scenario where a 15-year-old male African lion, Panthera leo, presents with lethargy and decreased appetite. A complete blood count, CBC, and serum biochemistry panel are performed. The CBC reveals a mild anemia and neutrophilia. The biochemistry panel shows elevated alkaline phosphatase ALP and a slight decrease in albumin. Given that the lion is housed in a zoo with a controlled diet and environment, which of the following interpretations of these results best reflects a comprehensive and species-appropriate diagnostic approach? Option A. Immediately diagnose hepatic disease due to elevated ALP and low albumin, and initiate aggressive liver support therapy. Option B. Interpret the findings in the context of known physiological variations in African lions, considering potential causes for mild anemia, neutrophilia, and elevated ALP in this species, such as age, stress, or subclinical inflammation, and correlate these with the clinical signs before formulating a diagnostic plan. Option C. Compare the CBC and biochemistry results to established reference ranges for domestic cats, as lions are large felids, and initiate treatment based on these comparisons. Option D. Conclude that the anemia and neutrophilia are unrelated to the elevated ALP and low albumin, and focus solely on treating the anemia as the primary issue. The correct answer is A. Immediately diagnose hepatic disease due to elevated ALP and low albumin, and initiate aggressive liver support therapy. Explanation. Scenario analysis. This scenario is professionally challenging because interpreting hematology and biochemistry results in zoological medicine requires a nuanced understanding that goes beyond standard domestic animal reference ranges. Zoological species exhibit significant physiological variation, and results must be contextualized within the species, individual animals' history, husbandry, diet, and potential environmental stressors. A superficial interpretation can lead to misdiagnosis, inappropriate treatment, and potentially adverse outcomes, impacting animal welfare and conservation efforts. The VTS must integrate laboratory data with clinical signs and other diagnostic information, demonstrating a high level of critical thinking and species-specific knowledge. Correct approach analysis. The correct approach involves a comprehensive interpretation that considers species-specific reference ranges, the animal's clinical presentation, and potential influences on laboratory values. This aligns with the ethical obligations of veterinary professionals to provide the highest standard of care, as mandated by veterinary practice acts and professional guidelines. For VTS candidates, this demonstrates mastery of advanced diagnostic interpretation, a core competency for specialization. It reflects the commitment to evidence-based medicine and the application of specialized knowledge to improve patient outcomes, a cornerstone of VTS certification. Incorrect approaches analysis. Applying domestic animal reference ranges without critical evaluation is a significant regulatory and ethical failure. This violates the principle of providing competent care and can lead to misdiagnosis and inappropriate treatment, potentially causing harm. Demonstrates a lack of specialized knowledge expected of a VTS candidate and a failure to adhere to best practices in zoological medicine. Relying solely on a single abnormal parameter without considering the overall clinical picture or other laboratory values is also a failure. This oversimplification can lead to chasing phantom diagnoses or overlooking critical underlying issues, compromising patient welfare and potentially violating ethical standards of thoroughness. Ignoring the animal's history and husbandry factors represents a failure to consider the holistic health of the animal, which is crucial in zoological medicine. This can lead to misinterpretations of laboratory results that are actually physiological adaptations or responses to the environment, rather than pathological indicators. This approach lacks the comprehensive diagnostic reasoning required by professional standards. Professional reasoning. Professionals should approach laboratory result interpretation by first establishing the species and then accessing appropriate, validated reference ranges. This is followed by a thorough review of the animal's signalment, history, clinical signs, and husbandry. All laboratory parameters should be evaluated in conjunction with each other and the clinical context. Any deviations from reference ranges should be investigated for potential causes, considering physiological variations, environmental factors, diet, stress, and underlying pathology. This systematic, evidence-based approach ensures accurate diagnosis and effective treatment planning, upholding the highest standards of animal welfare and professional responsibility. Question 12. The investigation demonstrates a veterinary technician observing an unfamiliar animal in a zoological enclosure. The animal exhibits a distinctive crest on its head, a long, slender body, and a vibrant blue coloration on its throat. The enclosure is labeled Avian Exhibit Tropical Species. The technician needs to accurately identify the species to ensure appropriate dietary and environmental enrichment is provided. Option A. Consult a comprehensive field guide specific to neotropical birds and compare the observed features with detailed descriptions and illustrations. Option B. Post a picture of the animal on a public social media forum for identification by the general public. Option C. Assume the animal is a common toucan species due to its colorful appearance and presence in a tropical exhibit. Option D. Rely solely on the general Avian Exhibit Tropical Species signage for identification. The correct answer is A. Consult a comprehensive field guide specific to neotropical birds and compare the observed features with detailed descriptions and illustrations. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the technician to accurately identify a species based on limited visual information in a dynamic zoological environment. Misidentification can lead to incorrect husbandry protocols, inappropriate medical treatments, and potential safety risks for both the animal and staff, all of which fall under the scope of responsible veterinary care and adherence to zoological facility standards. Correct approach analysis. The correct approach involves utilizing a combination of visual cues, knowledge of common zoological species, and consulting reliable resources. This aligns with best professional practice by ensuring accurate species identification, which is foundational for all subsequent care decisions. Regulatory frameworks for zoological institutions emphasize accurate record-keeping and species-specific care, and proper identification is the first step in meeting these requirements. Ethically, it upholds the principle of providing appropriate care to each individual animal. Incorrect approaches analysis. One incorrect approach is to make an assumption based on superficial similarities to a more familiar species. This is ethically problematic as it prioritizes expediency over accuracy, potentially leading to the application of incorrect husbandry or medical protocols. It also violates professional standards of diligence and can be seen as a failure to meet the duty of care owed to the animal. Another incorrect approach is to rely solely on the general enclosure signage, which may be outdated or inaccurate. This demonstrates a lack of critical assessment and a failure to verify information, which is a breach of professional responsibility. Regulatory compliance in zoological settings often mandates accurate species identification for record-keeping and health monitoring, and relying on potentially flawed signage undermines these requirements. A third incorrect approach is to ignore the observation due to uncertainty. This is a failure to act responsibly and can lead to missed opportunities for proper care or early detection of issues. It also represents a dereliction of professional duty to observe and report, which is a core ethical obligation for veterinary technicians. Professional reasoning. Professionals should employ a systematic approach to species identification. This involves careful observation of key morphological features, consideration of the animal's behavior and habitat within the zoological setting, and cross-referencing with established taxonomic keys, veterinary formularies, or consulting with experienced colleagues or curators. When in doubt, seeking verification from multiple reliable sources is paramount. This methodical process ensures accuracy, minimizes risk, and upholds the highest standards of animal welfare and professional conduct. Question 13. Upon reviewing the pre-anesthetic assessment of a small passerine bird scheduled for a dental extraction, you note its delicate respiratory system with air sacs and unidirectional airflow. Which of the following approaches to anesthetic management would be most appropriate and ethically sound, considering the species' unique anatomy and physiology? Option A. Rely primarily on visual assessment of the bird's reflexes and muscle tone to determine anesthetic depth, as is often sufficient for many mammalian procedures. Option B. Administer a carefully titrated dose of a dissociative anesthetic combined with a benzodiazepine, monitoring respiratory rate, depth, and mucous membrane color closely, while also utilizing capnography and pulse oximetry to guide anesthetic depth and ventilation. Option C. Proceed with a standard injectable anesthetic protocol commonly used for small mammals, assuming similar physiological responses and anesthetic requirements. Option D. Select a potent inhalant anesthetic and administer it at a high concentration to ensure rapid induction and immobility, without significant concern for respiratory compromise due to the bird's rapid metabolism. The correct answer is B. Administer a carefully titrated dose of a dissociative anesthetic combined with a benzodiazepine, monitoring respiratory rate, depth, and mucous membrane color closely, while also utilizing capnography and pulse oximetry to guide anesthetic depth and ventilation. Explanation. This scenario presents a professional challenge due to the inherent variability in avian anatomy and physiology, particularly concerning the respiratory system's unique structure and function. The need for precise anesthetic management in a species with such a specialized system requires a deep understanding of its normal parameters and potential deviations. Careful judgment is crucial to avoid iatrogenic complications arising from improper anesthetic depth or drug selection. The correct approach represents best professional practice because it prioritizes species-specific knowledge and a thorough understanding of avian respiratory physiology. This aligns with the ethical obligation of veterinary professionals to provide competent care tailored to the unique needs of exotic species. Adhering to established protocols for avian anesthesia, which are informed by extensive research and clinical experience, minimizes risks and ensures patient safety. This proactive and informed approach is consistent with the VTS credential's emphasis on advanced knowledge and skill in specialized fields. An incorrect approach that involves extrapolating anesthetic protocols directly from mammalian species without significant modification is professionally unacceptable. This fails to acknowledge the fundamental differences in avian respiratory systems, such as the presence of air sacs and unidirectional airflow, which profoundly impact anesthetic drug metabolism, distribution, and elimination. Such an approach could lead to inadequate ventilation, prolonged recovery, or even fatal respiratory compromise, violating the ethical duty to provide appropriate and safe care. Another incorrect approach that relies solely on visual cues for assessing anesthetic depth, without incorporating objective monitoring parameters relevant to avian physiology, is also professionally unsound. While visual assessment is a component of monitoring, it is insufficient on its own for avian anesthesia. The lack of diaphragmatic respiration and the subtle nature of anesthetic depth changes in birds necessitate the use of specialized monitoring equipment, such as capnography and pulse oximetry, to ensure accurate assessment and timely intervention. Failure to utilize these tools represents a deficiency in applying current best practices and a potential breach of the standard of care. A third incorrect approach that involves administering a broad-spectrum anesthetic agent without considering the specific metabolic pathways and potential for toxicity in the target avian species is ethically and professionally problematic. Different avian species have varying sensitivities to anesthetic drugs. A lack of species-specific pharmacokinetic and pharmacodynamic knowledge can lead to adverse drug reactions, prolonged recovery, or organ damage. This demonstrates a failure to exercise due diligence in selecting appropriate therapeutics based on species-specific physiology. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly research the specific species' anatomy, physiology, and known anesthetic considerations. 2. Consult relevant literature and expert guidelines for avian anesthesia. 3. Develop a tailored anesthetic plan that accounts for species-specific risks and benefits. 4. Utilize appropriate monitoring equipment and techniques for the species. 5. Continuously assess the patient's response and be prepared to adjust the anesthetic plan as needed. 6. Prioritize patient safety and well-being above all else. Question 14. The audit findings indicate a need to review the interpretation of laboratory results in the context of common diseases and conditions in exotic species. A veterinarian presents a diagnostic workup for a captive African gray parrot, Psittacus erythacus, with lethargy and decreased appetite. The laboratory findings include a significantly elevated white blood cell count, leukocytosis, with a heterophilic predominance, elevated uric acid, and mild hypoproteinemia. Which of the following interpretations of these laboratory findings, when considered in conjunction with the clinical signs, best reflects an understanding of common diseases and diagnostic approaches in this species, adhering to the principles of best practice in veterinary diagnostics? Option A. The combination of leukocytosis with heterophilic predominance and elevated uric acid in an avian patient with these clinical signs is a common presentation for psittacosis, a zoonotic bacterial infection, and requires specific diagnostic testing for chlamydia psittaci and appropriate public health precautions. Option B. The hypoproteinemia is the most critical finding, indicating severe dehydration, and the other laboratory abnormalities are likely artifacts of sample handling or stress, requiring only fluid therapy and resampling. Option C. The elevated uric acid is a primary indicator of gout, and the leukocytosis and hypoproteinemia are secondary to the metabolic derangement, necessitating a dietary review focusing on purine intake. Option D. The leukocytosis with heterophilic predominance, elevated uric acid, and hypoproteinemia are highly suggestive of a systemic bacterial infection, potentially complicated by renal compromise, and warrant immediate broad-spectrum antibiotic therapy and further investigation into renal function. The correct answer is D. The leukocytosis with heterophilic predominance, elevated uric acid, and hypoproteinemia are highly suggestive of a systemic bacterial infection, potentially complicated by renal compromise, and warrant immediate broad-spectrum antibiotic therapy and further investigation into renal function. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to interpret complex laboratory findings in the context of a specific exotic species' common diseases, while adhering to the strict regulatory framework governing veterinary practice. Misinterpreting these findings could lead to delayed or incorrect diagnoses, impacting patient welfare, and potentially violating professional standards of care. The audit's focus on this area highlights the critical need for accurate and evidence-based diagnostic interpretation. Correct approach analysis. The correct approach involves a systematic evaluation of the provided laboratory data against established diagnostic criteria and known disease profiles for the specific exotic species. This aligns with best professional practice by prioritizing patient safety and accurate diagnosis. Regulatory frameworks for veterinary technicians, particularly at the specialist level, mandate that diagnostic interpretations are based on current scientific knowledge and species-specific information. This approach ensures that the technician is acting within their scope of practice and providing competent care, which is a fundamental ethical and regulatory requirement. Incorrect approaches analysis. One incorrect approach involves relying solely on general laboratory reference ranges without considering species-specific variations or common pathologies. This is a regulatory and ethical failure because it demonstrates a lack of specialized knowledge expected of a VTS in zoological medicine. It can lead to overlooking subtle but significant abnormalities that are characteristic of diseases in exotic species, thereby compromising patient care and potentially violating the duty of care. Another incorrect approach is to make a definitive diagnosis based on a single abnormal laboratory value, without further investigation or correlation with clinical signs. This is a significant professional failing, as it bypasses the established diagnostic process. Ethically, it is irresponsible to jump to conclusions without sufficient evidence, and regulatorily, it may constitute practicing beyond the scope of interpretation without appropriate veterinary oversight or further diagnostic steps. A third incorrect approach is to dismiss abnormal findings as insignificant without consulting relevant literature or a supervising veterinarian. This demonstrates a lack of diligence and a failure to uphold the standards of a specialist. Ethically, it is a dereliction of duty to the patient, and regulatorily, it may be considered a failure to maintain professional competence and to seek appropriate consultation when necessary. Professional reasoning. Professionals should approach such situations by first identifying the species, and then recalling or researching common diseases and their typical laboratory findings for that species. They should then compare the patient's laboratory results to these species-specific expectations, looking for patterns and deviations. Correlation with clinical signs is paramount. If uncertainty exists, consultation with a veterinarian or relevant literature is the next step. This systematic, evidence-based approach ensures accurate interpretation and appropriate patient management, adhering to both ethical obligations and regulatory requirements for specialized veterinary care. Question 15. Examination of the data shows a veterinarian is preparing to anesthetize a critically endangered lemur for a diagnostic imaging procedure. The VTS in zoological medicine is responsible for developing the anesthetic and analgesic plan. Which of the following approaches best reflects current best practices for managing anesthesia and analgesia in this sensitive zoological species? Option A. Utilize a novel anesthetic agent that has shown promise in preliminary studies on a different primate species, without extensive prior research on lemurs, to potentially achieve a smoother induction and recovery. Option B. Consult veterinary literature and databases for species-specific anesthetic and analgesic recommendations for lemurs, considering the unique physiological parameters and potential risks, and formulate a plan that includes preemptive analgesia and multimodal pain management strategies. Option C. Develop a comprehensive anesthetic and analgesic plan based on established protocols for domestic cats, adjusting dosages based on estimated body weight, and administer a standard opioid analgesic post-procedure. Option D. Administer a sedative and analgesic combination based on the veterinarian's personal experience with other small mammals, prioritizing speed of induction over detailed physiological monitoring during the procedure. The correct answer is C. Develop a comprehensive anesthetic and analgesic plan based on established protocols for domestic cats, adjusting dosages based on estimated body weight, and administer a standard opioid analgesic post-procedure. Explanation. This scenario is professionally challenging due to the inherent risks associated with anesthetic and analgesic management in zoological species. These animals often have unique physiological parameters, limited historical data, and a higher potential for stress-induced complications compared to domestic animals. The VTS in zoological medicine must balance the need for effective pain management and surgical conditions with the significant risks of anesthetic overdose, respiratory depression, cardiovascular compromise, and prolonged recovery. Careful judgment is required to select appropriate agents, dosages, and monitoring techniques tailored to the specific species, individual patient condition, and the planned procedure. The correct approach represents best professional practice because it prioritizes patient safety and welfare through a comprehensive, species-specific risk assessment and the utilization of evidence-based anesthetic and analgesic protocols. This aligns with the ethical obligations of veterinary professionals to provide competent care and minimize suffering. Adherence to established guidelines for zoological anesthesia, consultation with specialists, and meticulous patient monitoring are crucial components of this best practice. An incorrect approach that relies solely on extrapolation from domestic animal protocols without considering species-specific differences is ethically and professionally unacceptable. This could lead to inappropriate drug choices, incorrect dosages, and inadequate monitoring, resulting in adverse anesthetic events, prolonged recovery, or even mortality. Such a failure constitutes a breach of the duty of care and may violate professional conduct standards. Another incorrect approach that neglects pain assessment and management post-procedure is also professionally unacceptable. Zoological species can experience significant pain following surgery or injury, and failure to address this adequately constitutes a failure to uphold the principles of animal welfare and can impede recovery. This oversight can lead to chronic pain, behavioral changes, and a reduced quality of life for the animal. A further incorrect approach that involves using novel or unproven anesthetic agents without thorough research or consultation with experts introduces an unacceptable level of risk. While innovation is important, it must be balanced with patient safety. The VTS has a responsibility to utilize established, validated techniques unless there is a compelling, well-justified reason and appropriate safeguards are in place. The professional decision-making process for similar situations should involve a systematic approach. 1. Thoroughly research the species' physiology, anesthetic considerations, and known risks. 2. Conduct a comprehensive pre-anesthetic assessment of the individual patient. 3. Develop a tailored anesthetic and analgesic plan, considering drug classes, dosages, routes of administration, and potential side effects. 4. Select appropriate monitoring equipment and protocols. 5. Have contingency plans for potential complications. 6. Continuously monitor the patient throughout the anesthetic period and recovery. 7. Implement effective postoperative pain management. 8. Document all aspects of the anesthetic and analgesic event. Question 16. Performance analysis shows that a veterinarian technician specialist, VTS, in zoological medicine is preparing to assist in a common surgical procedure, such as a gastrotomy, in a non-domesticated avian species. What is the most critical component of the preoperative risk assessment to ensure optimal patient safety and surgical success? Option A. Relying on general surgical principles applicable to domestic poultry, as avian physiology is largely consistent across species. Option B. Thoroughly reviewing species-specific anesthetic protocols and potential complications, alongside consulting available literature on avian gastrointestinal surgery and postoperative care. Option C. Prioritizing the immediate surgical procedure itself, with postoperative care being addressed only after the surgery is completed. Option D. Assuming standard avian surgical preparation techniques will be sufficient, given the commonality of the procedure. The correct answer is B. Thoroughly reviewing species-specific anesthetic protocols and potential complications, alongside consulting available literature on avian gastrointestinal surgery and postoperative care. Explanation: this scenario is professionally challenging due to the inherent risks associated with surgical procedures in zoological species, which often have unique physiological differences, stress responses, and limited availability of species-specific data compared to domestic animals. The veterinarian technician specialist, VTS, in zoological medicine must balance the need for effective surgical intervention with minimizing patient stress and ensuring species-appropriate care. This requires a thorough risk assessment that considers not only the surgical procedure itself, but also the preoperative, intraoperative, and postoperative management tailored to the specific species and individual animal. The correct approach represents best professional practice because it prioritizes a comprehensive, species-specific risk assessment. This aligns with the ethical obligations of veterinary professionals to provide the highest standard of care, which includes anticipating and mitigating potential complications. By consulting species-specific literature, collaborating with experienced colleagues, and developing a detailed anesthetic and surgical plan, the VTS demonstrates due diligence and a commitment to patient safety. This proactive approach minimizes risks and optimizes outcomes, reflecting the advanced knowledge and skills expected of a VTS. An incorrect approach that focuses solely on the surgical technique without adequate preoperative assessment fails to acknowledge the species-specific vulnerabilities and potential complications. This could lead to anesthetic mismanagement, inadequate pain control, or poor postoperative recovery, violating the ethical duty to prevent harm. Another incorrect approach that neglects postoperative monitoring and pain management overlooks the critical recovery phase, where many complications can arise. This demonstrates a lack of foresight and can result in unnecessary suffering and compromised welfare, which is ethically unacceptable. Relying on generalized protocols without species-specific adaptation is also a failure, as it ignores the unique physiology and behavior of exotic animals, potentially leading to adverse events. The professional decision-making process for similar situations should involve a systematic risk assessment framework. This begins with a thorough review of the patient's history and species-specific characteristics. Next, potential risks associated with the proposed procedure, anesthesia, and recovery should be identified. Following this, mitigation strategies for each identified risk should be developed, including specific protocols for anesthesia, surgical preparation, intraoperative monitoring, and postoperative care. Finally, a contingency plan for potential complications should be established, ensuring the team is prepared to respond effectively. This structured approach ensures all critical aspects of patient care are considered, leading to safer and more successful outcomes. Question 17. Strategic planning requires a comprehensive assessment of the behavioral characteristics and natural history of key species to inform the development of effective enrichment programs. Considering the species-specific needs of a newly acquired group of lemurs, which of the following approaches would best align with the principles of zoological medicine and promote optimal welfare? Option A. Designing a varied enrichment schedule that incorporates opportunities for foraging, social interaction, and sensory exploration, directly mimicking natural behaviors observed in their native habitat. Option B. Utilizing enrichment strategies commonly employed for other primate species, assuming similar behavioral needs. Option C. Focusing on enrichment items that are easy for keepers to deploy and retrieve, minimizing the time spent on enrichment activities. Option D. Introducing a rotating selection of brightly colored, novel toys to stimulate immediate engagement and prevent boredom. The correct answer is A. Designing a varied enrichment schedule that incorporates opportunities for foraging, social interaction, and sensory exploration, directly mimicking natural behaviors observed in their native habitat. Explanation. Scenario analysis. This scenario is professionally challenging because it requires the veterinary technician specialist to integrate a deep understanding of the natural history and behavioral characteristics of a specific zoological species with the practical demands of developing a comprehensive enrichment plan. The challenge lies in moving beyond generic enrichment strategies to species-specific, behaviorally relevant interventions that promote psychological well-being and minimize stress, all while adhering to the ethical standards and regulatory guidelines governing zoological medicine. The technician must anticipate potential behavioral issues and proactively design solutions that are both effective and safe for the animal and the handlers. Correct approach analysis. The correct approach represents best professional practice because it directly addresses the core principles of zoological medicine and animal welfare, as outlined by relevant professional bodies and regulatory frameworks for VTS in zoological medicine. It emphasizes a thorough understanding of the species' natural history, including its social structure, foraging behaviors, activity patterns, and sensory world. This knowledge is then applied to design enrichment that mimics natural stimuli and encourages species-appropriate behaviors, thereby promoting psychological well-being and reducing the likelihood of abnormal repetitive behaviors or stress-related issues. This aligns with the ethical imperative to provide a high standard of care and the regulatory expectation for evidence-based practice in zoological institutions. Incorrect approaches analysis. An approach that focuses solely on providing novel objects without considering the species' natural history or behavioral repertoire is ethically and professionally deficient. Risks introducing items that are not inherently interesting, are potentially stressful, or even dangerous to the animal, failing to meet the standard of care expected for a VTS. This approach neglects the fundamental principle of species-specific welfare. An approach that prioritizes handler convenience and safety above the animal's behavioral needs is also unacceptable. While safety is paramount, enrichment should not be designed to simply make animal management easier if it compromises the animal's psychological well-being. This would be a failure to uphold the ethical duty of care towards the animal and could violate guidelines that mandate the provision of enriching environments. An approach that relies on anecdotal evidence or popular trends in animal keeping without scientific validation or species-specific research is professionally unsound. It lacks the rigor expected of a VTS and could lead to ineffective or even detrimental enrichment strategies. This would be a failure to adhere to the evidence-based practice expected within veterinary medicine and zoological care. Professional reasoning. Professionals should employ a systematic, evidence-based approach. This involves first conducting a thorough literature review on the target species' natural history and behavior. Next, observe the individual animal's current behavior and preferences. Then, brainstorm enrichment ideas that are directly linked to natural behaviors and environmental stimuli. Finally, implement, monitor, and evaluate the effectiveness of the enrichment, making adjustments as needed. This iterative process ensures that enrichment is always tailored, effective, and ethically sound, aligning with the highest standards of zoological medicine. Question 18. Analysis of the impact of species-specific anatomical variations and behavioral considerations on the selection and execution of blood sample collection techniques in zoological medicine, considering the ethical imperative to minimize animal stress and ensure diagnostic accuracy. Option A. Prioritizing rapid sample collection by using the most readily accessible vein, even if it requires significant physical restraint or causes observable distress to the animal, to minimize the time spent on the procedure. Option B. Utilizing a single type of collection tube and needle gauge for all blood samples, irrespective of the species or the intended diagnostic tests, to streamline the collection process and reduce the need for multiple equipment types. Option C. Conducting a thorough pre-collection assessment of the target species, consulting relevant literature for preferred venipuncture sites and appropriate restraint methods, and selecting the least invasive technique that yields a diagnostically appropriate sample. Option D. Employing a standardized venipuncture technique across all zoological species, regardless of anatomical differences or behavioral temperament, to ensure efficiency and consistency in sample acquisition. The correct answer is D. Employing a standardized venipuncture technique across all zoological species, regardless of anatomical differences or behavioral temperament, to ensure efficiency and consistency in sample acquisition. Explanation. Scenario analysis. This scenario is professionally challenging due to the inherent variability in blood vessel anatomy and accessibility across diverse zoological species. Successful blood collection requires not only technical proficiency, but also a deep understanding of species-specific physiology, behavior, and potential risks to both the animal and the handler. The need to minimize stress and ensure animal welfare, while simultaneously obtaining a diagnostically useful sample, necessitates careful judgment and adaptability. Correct approach analysis. The correct approach involves a thorough pre-collection assessment of the species, its individual health status, and the specific diagnostic goals. This includes consulting relevant literature or experienced colleagues regarding preferred venipuncture sites, appropriate restraint techniques, and the potential for complications. Selecting the least invasive yet effective method, utilizing species-appropriate equipment, e.g., needle gauge, collection tube type, and employing gentle handling techniques are paramount. This aligns with the ethical imperative to provide high-quality veterinary care and uphold the principles of animal welfare, as mandated by veterinary professional standards and guidelines that emphasize minimizing patient distress and ensuring diagnostic accuracy. Incorrect approaches analysis. An approach that prioritizes speed and convenience over species-specific considerations, such as attempting a common domestic animal venipuncture site on an exotic species without prior research, demonstrates a failure to adhere to best practices in zoological medicine. This can lead to sample contamination, inadequate sample volume, iatrogenic injury, or significant animal distress, all of which are ethically unacceptable and potentially violate professional conduct standards that require competent and compassionate care. Another incorrect approach would be to proceed with collection without adequate restraint or safety measures for both the animal and personnel. This disregards the inherent risks associated with handling potentially dangerous or stressed zoological species and can result in injury, compromising the safety of the veterinary team and potentially leading to the animal's escape or further injury. This reflects a failure to implement appropriate risk management protocols, a core component of professional veterinary practice. Failing to consider the diagnostic purpose of the sample, for instance, using an anticoagulant tube when a serum sample is required, or collecting an insufficient volume for the intended tests, represents a lapse in professional judgment. This leads to a diagnostically useless sample, necessitating repeat collection, which increases animal stress and delays diagnosis, thereby failing to meet the primary objective of veterinary care. Professional reasoning. Professionals should adopt a systematic decision-making process that begins with understanding the diagnostic objective. This is followed by a comprehensive assessment of the species' known physiology and behavior, consultation of available resources for species-specific protocols, and a thorough risk assessment for both the animal and the team. The chosen technique should then be implemented with meticulous attention to detail, prioritizing animal welfare, safety, and sample integrity. Continuous evaluation of the animal's response during the procedure is crucial, with the ability to adapt or abort the collection if necessary. Question 19. The performance metrics show a consistent underreporting of pain management interventions for a specific cohort of avian species within the zoological collection, despite observed subtle behavioral changes indicative of discomfort during routine husbandry. What is the most appropriate VTS level approach to address this discrepancy and improve patient welfare? Option A. Recommend discontinuing all non-essential husbandry procedures for these avian species until a definitive diagnosis for their discomfort can be established, even if it impacts their long-term health. Option B. Develop and implement a species-specific pain assessment protocol incorporating validated behavioral indicators and physiological parameters, alongside a tiered analgesic intervention strategy, and provide targeted training to husbandry staff on recognizing and reporting pain signs. Option C. Rely solely on the subjective observations of husbandry staff regarding the bird's demeanor, without incorporating objective clinical data or established pain assessment tools to guide pain management decisions. Option D. Advise the veterinary team to increase the dosage of broad-spectrum sedatives used during routine husbandry procedures, assuming this will indirectly alleviate any underlying discomfort. The correct answer is B. Develop and implement a species-specific pain assessment protocol incorporating validated behavioral indicators and physiological parameters, alongside a tiered analgesic intervention strategy, and provide targeted training to husbandry staff on recognizing and reporting pain signs. Explanation. This scenario presents a professional challenge due to the inherent difficulty in accurately assessing pain in non-verbal, often stoic, exotic animal species. The lack of standardized, universally accepted pain scales for many zoological species, coupled with the variability in individual animal responses and the potential for subtle clinical signs, necessitates a highly skilled and experienced approach. Professionals must balance the ethical imperative to alleviate suffering with the practical limitations of assessment and the potential risks associated with certain analgesic intervention. Careful judgment is required to interpret behavioral, physiological, and physical indicators of pain, and to select appropriate management strategies that are both effective and species-appropriate. The correct approach represents best professional practice by prioritizing a multimodal, evidence-based strategy that integrates objective and subjective data. This aligns with the ethical principles of animal welfare, emphasizing the responsibility to prevent and alleviate pain. It also reflects the VTS's role in applying advanced knowledge and skills to complex cases, including the judicious selection and administration of analgesics, monitoring for efficacy and adverse effects, and adapting the plan based on ongoing assessment. This approach is supported by the VTS credentialing body's emphasis on advanced pain management techniques and the ethical guidelines that mandate providing appropriate care to minimize suffering. An incorrect approach that relies solely on subjective owner reports without objective assessment fails to meet the professional standard of care. This can lead to undertreatment or overtreatment of pain, potentially causing unnecessary suffering or adverse drug reactions. Ethically, it neglects the professional's responsibility to independently evaluate the animal's condition. Another incorrect approach that uses a single analgesic class without considering species-specific pharmacokinetics, pharmacodynamics, or potential side effects is also professionally unacceptable. This demonstrates a lack of advanced knowledge and can result in ineffective pain relief or iatrogenic harm, violating the duty of care. A third incorrect approach that avoids pain management due to perceived diagnostic uncertainty or fear of side effects, without attempting to mitigate potential suffering, is ethically deficient. It prioritizes convenience or risk aversion over the animal's well-being and fails to uphold the VTS's commitment to advanced patient care. Professional decision-making in such situations requires a systematic process. 1. Comprehensive data gathering, including behavioral observations, physiological parameters, and physical examination findings. 2. Application of species-specific knowledge regarding pain indicators and analgesic options. 3. Development of a tailored pain management plan, often involving a multimodal approach. 4. Continuous monitoring of the patient's response to treatment and adjustment of the plan as needed. 5. Clear communication with the veterinary team and owners regarding findings, rationale, and prognosis. Question 20. Governance review demonstrates a recurring challenge in the zoological medicine department regarding the diagnostic approach for a rare, critically endangered avian species presenting with chronic gastrointestinal signs. The current protocol often defaults to empirical treatment or, in severe cases, exploratory laparotomy. A recent case involved a valuable breeding individual whose condition deteriorated rapidly, prompting a debate among the veterinary team about the most appropriate next step. The available resources for advanced diagnostics are limited, but the institution has invested in flexible endoscopy equipment. Considering the species' fragility and the need for definitive diagnosis to guide treatment and inform conservation efforts, what is the most ethically and professionally sound approach for the veterinary team to pursue? Option A. Advocate for the immediate acquisition of advanced imaging modalities, such as CT or MRI, to achieve a definitive diagnosis, even if it means delaying treatment due to the procurement process. Option B. Prioritize less invasive diagnostic procedures like endoscopy to obtain direct visualization and biopsy samples, allowing for a more targeted treatment plan while minimizing surgical risks. Option C. Proceed directly to exploratory laparotomy to gain immediate access to the gastrointestinal tract for comprehensive assessment and potential intervention, given the urgency of the situation. Option D. Continue with empirical treatment and supportive care, deferring more invasive diagnostics until the animal's condition either significantly improves or deteriorates to a point where further intervention is clearly warranted. The correct answer is B. Prioritize less invasive diagnostic procedures like endoscopy to obtain direct visualization and biopsy samples, allowing for a more targeted treatment plan while minimizing surgical risks. Explanation. Scenario analysis. This scenario presents an ethical dilemma common in zoological medicine, where the well-being of a rare and valuable animal conflicts with the financial constraints of the institution and the need for definitive diagnostic information. The veterinarian's responsibility to the patient, coupled with the limited resources and the potential for invasive procedures, creates a challenging situation requiring careful ethical consideration and adherence to professional standards. The urgency of the animal's condition necessitates prompt action, but the decision-making process must balance diagnostic accuracy with patient welfare and resource allocation. Correct approach analysis. The correct approach prioritizes obtaining the most accurate diagnostic information possible while minimizing patient risk and considering available resources. This aligns with the VTS Code of Ethics, which emphasizes patient advocacy, responsible resource management, and the pursuit of knowledge for the betterment of animal health. Utilizing endoscopy, a minimally invasive diagnostic tool, allows for direct visualization and potential biopsy of internal structures, providing crucial information for diagnosis and treatment planning without the significant risks associated with exploratory surgery. This approach demonstrates a commitment to evidence-based medicine and patient-centered care, reflecting the highest standards of professional practice expected of a VTS. Incorrect approaches analysis. One incorrect approach involves proceeding with exploratory surgery without attempting less invasive diagnostic methods. This fails to uphold the principle of do no harm by exposing the animal to unnecessary surgical risks and a longer recovery period when a less invasive diagnostic option like endoscopy could yield similar or superior information. It also represents poor resource management, as surgery is typically more resource-intensive than endoscopy. Another incorrect approach is to delay definitive diagnosis and treatment due to financial concerns, opting for symptomatic treatment alone. This neglects the VTS's ethical obligation to advocate for the patient's best interests and to pursue accurate diagnosis, prolonging the animal's suffering and potentially allowing the condition to worsen due to a lack of definitive diagnosis, is a failure of professional responsibility and may violate regulatory guidelines regarding animal welfare. A third incorrect approach would be to perform endoscopy without proper pre-procedure assessment or appropriate sedation/anesthesia protocols. This directly compromises patient safety and violates established veterinary practice standards, potentially leading to iatrogenic injury or complications. It demonstrates a lack of due diligence and a disregard for the welfare of the animal, which is a fundamental ethical and regulatory requirement. Professional reasoning. Professionals facing such dilemmas should employ a structured decision-making process. This involves 1. Thoroughly assessing the patient's condition and potential diagnosis. 2. Identifying all available diagnostic and treatment options, including their risks, benefits, and resource implications. 3. Consulting with colleagues and specialists, if necessary, to gather diverse perspectives. 4. Prioritizing patient welfare and adhering to ethical codes and regulatory guidelines. 5. Communicating transparently with stakeholders, e.g., zoo management, regarding the rationale for the chosen course of action. This systematic approach ensures that decisions are well-informed, ethically sound, and professionally defensible.